Hello, everyone. In this video, we'll talk about type 1 autoimmune diabetes. So type 1 autoimmune diabetes leads to destruction of the pancreatic beta cells which secretes insulin. As a result, body would face a very low level of insulin. This results in high blood glucose level and low glucose mobilization to the tissues. Before understanding the nitty-gritty details of optimum diabetes, the complicated immune responses, we should take it slowly and start from the very basics. So you must be familiar with the term sugar. And you must have heard this term from your father or grandfather. So what does that mean? The medical term of it is known as diabetes. So diabetes simply means elevated blood sugar level, and there could be consequences associated with it. But wait a second, why elevated blood glucose level is bad? In fact, our body use carbohydrate, protein, fat as their fuel, and especially if body has choice, it would be driven more towards carbohydrate utilization. So why at all carbohydrate is bad? The point is carbohydrate is not bad. Neither is glucose, but when body cannot mobilize glucose, then it is bad. So in diabetes, there is glucose, but body cannot utilize it after a meal. When the blood glucose level is elevated, in a normal person, it would be moving to the muscle, liver, or adipose tissues for utilization, but for a diabetic patient, this process is not happening. Utilization of glucose is hampered. So even if glucose is there, body cannot utilize it. And that brings out the complication: the excess amount of glucose in the blood might have severe consequences. Now, there could be many reasons for diabetes, and over 30 million of people in us are affected by diabetes. Annually, $100 billion is spent on diabetes-related medications. So the situation is severe, right? And the situation is not good globally because in South Asia or Western Pacific countries the incident is increasing day by day. So let's say you have taken a meal full of glucose. Now what would happen is your blood glucose level would increase. But after the steep increase, it would also decrease because body would try to utilize that glucose and mobilize that glucose. Goes into several tissues such as muscle, adipose tissues, or liver, and that is happening in the normal person. But this phenomena is not true for a diabetic individual, But blood glucose level would be increased and stay in an elevated level for a very long time, because body is finding it difficult to mobilize the glucose. Now our pancreatic BSCL secretes insulin, which is a peptide hormone, and it takes crucial role for glucose mobilization, and insulin is secreted by the pancreatic beta cells. So obviously, if your pancreatic beta cells are dying, then insulin level would be low. And there is another type of diabetes, which is type 2 diabetes, where our body gets resistant to insulin. That means our body cannot respond to insulin. In the first case, our body can't secrete insulin due to the destruction of the source. And the second case, even if there is insulin, body cannot respond to it. So these two things are different. Our focus is type 1 diabetes in this video. So there are many genetic factors and immune components which leads to the complication of type 1 autoimmune disease. One major thing is human leukocyte antigen, which give rise to MCHE molecules, but one Ali, which is Dr. 3, Hull A, DR3 and Hull A DR4 are found to be associated with diabetic individuals who are suffering from type 1 diabetes. They have insulin and they have many surface markers, and our own body treat them as foreign and generates or 2 antibodies against them. These generation of autoantibodies might have consequences because cells like macrophages and dendritic cells would recognize these autoantibodies with its Fc receptor. Now these macrophages and dendritic cell can instantly secrete inflammatory cytokines such as IL-1, IL-6, and TNF-alpha. This leads to attraction of many other cell types and increased inflammation. It attracts one subpopulation of cells and many other cell types. Moreover, any cell type can show its self-antigen displayed on class 1 image molecule. And this pancreatic beta cell also do the same. But these antigens, which is not supposed to be detected as foreign, is now detected as foreign by our cytotoxic T cell, and as a result, cytotoxic T cell secretes barphyrin and granzyme, which kills the pancreatic beta cell. Once pancreatic beta cell is destroyed, there would be very less insulin which is secreted. Right. So here you can see on the left-hand side, there is the normal distribution of pancreatic beta cell, which has dramatically reduced in our individual suffering from type 1 diabetes, and that's a measure cause and a major pathophysiological symptom. And as a result, you can clearly understand when insulin level is low. There is no blood glucose mobilization or very less blood glucose mobilization, and as a result, blood glucose level would be high or elevated for a long time, which leads to many adverse consequences in type 1 diabetes. Now, there are many solutions to type 1 diabetes. One primary solution is to take more insulin from external source. Now, body needs insulin after mean to mobilize glucose, and body simply can produce. So putting insulin from external source would help in this case. So the stages of diabetes type 1 is the following. There is a genetic risk, immune activation, immune response, and there would be detection phases, and there are many individuals which have different genetic makeup who are more susceptible to type 1 diabetes, and then in a different video, I'll be talking more about that. But this video was an overall summary about the immune reaction that happens in autoimmune type 1 diabetes and its complications. So I hope you enjoyed this video. If you like this video, give it a quick thumbs up. Don't forget to like, share, and subscribe. And please follow me on my channel. You can support my channel. Your support can really help my channel to grow.